My name is Dr. Nathan Cole, and I was a third-year surgical resident at St. Matthew's Trauma Center when this case found me. I tell you that up front because the ER has a way of defining you more than your own reflection does. When you're buried in scrubs night after night, living under fluorescent lights that never dim, the hospital becomes less a place of work and more a mirror that shows you what kind of person you really are. I had already seen enough blood, broken bodies, and impossible losses by then to know medicine was not just about skill but endurance. What I didn't know, at least not yet, was that sometimes the walls between science and something darker are thinner than we'd like to admit. St. Matthew's sits in the center of a city that never really sleeps, not because it's glamorous, but because the sirens never stop. Some nights, the ambulances would queue up at the bay like taxis at an airport, each carrying a story that would demand more of us than we had left to give. We learned to carry it anyway. The ER was chaos organized into ritual. Gurneys rattling over tile, monitors chanting in uneven rhythms, nurses moving like practiced dancers through an endless performance. I'd gotten used to the smell, too. Bleach, sweat, iron. The smell that clings even after you've showered twice. That night, it was quiet in a way that makes you suspicious. We had patched up a bar fight, stitched a forehead, admitted a pneumonia. I was at the desk, signing charts with the weary focus of someone trying not to blink too long, when triage buzzed in. Walk-in. Dizziness, nausea, swelling behind the ear. Not the kind of case that makes your heart spike. A lump behind the ear usually meant something small, something outpatient. But in trauma, you learn never to trust the ordinary. They brought him back to bed 12, one of the side rooms where sound seems to sink into the walls. He walked in under his own power, though he leaned a little too heavily on the nurse's arm. His name was Evan Whitaker. Early 30s, carpenter by the look of his hands, skin weathered by sun more than city light. His eyes were clear but unsettled, as if he'd been listening to something none of us could hear. Dizzy spells, the triage nurse said. Lump came up last week, got worse. I introduced myself, asked the usual questions. No head trauma, no fever, no recent ear infections. He shook his head slowly, like even that motion carried weight. It's not just pain, he said. Feels like something's pulling me sideways. Then he did something most patients don't. He brushed his hair aside, turned his head, and guided my hand to the swelling. It was firm, oval, no bigger than a walnut. The skin over it wasn't red or angry, just raised. But the moment my fingers pressed against it, I felt a warmth I couldn't explain. Not fever warmth, not skin warmth, something deeper, like touching a stone that had been left in the sun. I pulled my hand back, tried to keep my voice level. How long has it been there? I asked. Started small about a week ago, but it's not just the lump, it's louder now. Louder? He nodded, eyes darting to the corners of the room, not like ringing in the ear, louder like it's closer, like it's trying to be heard. I glanced at the nurse, Janelle, who raised her eyebrows the way seasoned nurses do when they've heard stranger things but still want you to notice. I told myself to stay clinical, to ground this in what I knew. Cysts. Swollen lymph nodes. Mastoiditis, though rare in someone his age. All explainable, all manageable. Still, I couldn't ignore the way he spoke. Not like a man describing discomfort, but like someone describing a presence. We checked his vitals. Stable, temperature normal, heart rate steady. Nothing about him suggested urgency. Yet the air in that room had changed the moment he walked in. It felt heavy, expectant, the way the air feels before a storm you didn't see coming. I asked him to describe the dizziness. It's like being tilted, he said. Like gravity's different on one side. Sometimes when I'm lying in bed, it feels like something's pressing me toward the wall. Any ringing? Loss of hearing? He hesitated. Not ringing, more like a flutter, like wings maybe, behind the ear, not in it. I wrote his words down, even though they wouldn't fit neatly into a medical note. His metaphors carried more weight than most patients' symptoms. Janelle returned with the portable monitor, clipped the pulse ox to his finger. The numbers blinked up steady. Oxygen 98, heart rate 84. But for just a second, the line jumped 98 to 82 to 99 in the space of 2 breaths. Too fast to be real. A glitch, I thought. Equipment lies sometimes. Evan noticed. There, did you feel it? Feel what? I asked. The shift. He tapped behind his ear gently, like the lump was listening. It's closer. I forced a smile, told him we'd run some quick tests and ordered a CT scan to get a better look. But inside, I felt the first thread of unease. Not because of what I had found, but because of what I hadn't. The lump wasn't acting like anything I'd been trained to expect. While we waited for transport, the room fell quiet. Too quiet. The ER is never truly silent, but in that moment, the usual chorus, the beeps, the muffled voices, the shuffle of shoes, seemed to dim around us. I stood at the foot of the bed, trying to shake it off, when I heard something I still can't explain. It wasn't a voice. It wasn't a sound the way you think of sound. It was more like a pressure in my ear, low and steady, as if the room itself had developed a second heartbeat. It pulsed in rhythm, faint but undeniable. I looked at Janelle, and by the way her expression froze, I knew she heard it too. "What is that?" she whispered. I shook my head, but I didn't have an answer. Evan just smiled faintly, almost sadly. "You hear it now, don't you?" That was the moment I stopped thinking of the lump as a medical problem and started wondering, against every shred of training in me, whether it was something else entirely. Transport took longer than it should have, which is the hospital's way of telling you it has its own priorities. Stroke alert on the other side of the building. Radiology juggling inpatients and emergencies. A tech on break because even machines need people to keep them honest. I kept glancing at the clock in bed 12, not because the minutes mattered, but because the second hand had begun to look like a pendulum measuring something I couldn't name. Evan lay still, hands folded over his stomach, the way patients do when they've decided to cooperate with the universe. Every so often his fingers twitched toward the lump and stopped, as if he was afraid of waking something sleeping under his skin. Janelle stood by the monitor, watching the green numerals behave like good citizens. Heart rate in the 80s, oxygen in the high 90s, pressure polite and middle of the road. The figures soothed me the way a lullaby soothes a child. Comforting, but not binding. Numbers tell a story, but they never tell you if you're reading the right book. I rolled the ultrasound cart back in, because doing something always beats waiting. This time, I didn't push the probe into the mass. I skimmed along the edge, mapping borders the way you trace a shoreline with your eyes from a cliff. The image bloomed in grayscale. Skin, fat, the bright seam of a capsule, a shadowed center that refused to settle on a category. I toggled the color wash once, quick, more to irritate myself than to discover anything new. For a blink the screen smeared into confetti, then snapped back. Interference, I muttered, half to the machine, half to the part of me that wanted the night to return to its rails. Evan watched me watch the screen. "You're looking for something to blame," he said softly. There was no accusation in it, just recognition. I was, and I hated that he was right. Transport arrived at last. Andre, a CT tech with a quiet grin and a roll of lead aprons that looked heavier than both of us. "You, my VIP?" he asked Evan. "We'll get your head pictures and have you back before the coffee gets cold." Evan smiled, because people like Andre build ladders out of humor when the floor starts to tilt. We moved through the ER in that odd procession that makes you feel both essential and helpless at once. Me at the head, Janelle steering the IV pole like a mast, Andre with the chart and the calm, Evan the center of gravity everyone pretends not to orbit. The ER lights hummed like they always do, but as we turned into radiology, the sound deepened, as if we'd walked under a bridge carrying something enormous. The CT suite is a chapel for the mechanical faithful. White walls, white gantry, polite signs telling you not to move, not to breathe, not to be complicated. The machine's voice is always the same, gentle authority with no room for negotiation. Andre helped Evan onto the table and centered his head in the cradle with the kind of care you only learn by positioning 1,000 skulls. "You'll feel the table move," he said. "If we do contrast later, you'll get a warm flush. Feels like you peed yourself. Everyone survives the embarrassment." Evan laughed once, genuinely, and the room felt human again. The scout image appeared on the console, a familiar, ghostly outline. Thin slices began to populate the screen in a rhythm Andre could probably hear in his sleep. I stood behind the glass, arms folded, eyes landing where the lump would translate into pixels. It did, obediently. An oval at the back edge of the scalp, neatly walled off, sitting on top of bone like a pressed coin under cloth. No bony erosion, no invasion into air cells, nothing erasing the clean geometry of mastoid honeycomb. The slices marched, and relief arrived right on schedule. This looked like a cyst, a thing you schedule, not a thing that schedules you. "Clean," Andre murmured. "He'll like this story." The hum rose one notch, like someone turning a dimmer switch the wrong way. Maybe a fan engaged in the gantry. Maybe my own pulse learning to impersonate the room. I glanced up at the overhead fluorescent panel. It flickered once, a fast eyelash flutter, and steadied. Andre frowned at the console. "Huh," he said. "We got a micro-stutter." "What's that mean?" I asked. "Means nothing," he said, and tapped the monitor with a knuckle, an old ritual like knocking on wood. The images kept arriving, perfect and clean. Evan's chest rose and fell on the table in a steady line. I watched his hands. One finger twitched, just at the knuckle, a tiny metronome of unease. The machine finished with a satisfied chime. Andre came around and slid the table out with the gentle care of someone setting a book back on a shelf. "All right, my friend," he said, unfastening the headrest. "Pictures look real boring. Boring is good." Evan nodded and looked past him, not at me, past me, as if something had stepped into the doorway and settled there to listen. "You feel that?" he asked. "No," I said reflexively. Then, "What?" Like the room leaned. He pressed his lips together, embarrassed by how it sounded. I didn't laugh. There are times to teach people their bodies do tricks. This wasn't one of them. We rolled him back toward the ER. The hallway felt longer, as if radiology had drifted a few inches farther down the corridor while we weren't looking. We passed the vending machines that always sound a little sorrowful at this hour. A phlebotomist in pink scrubs hurried by, eyes on a label like the answer was printed there. As we turned the corner by the service elevator, Evan inhaled sharply and reached for his ear. "Easy," I said, but he wasn't pressing to stop pain. His hand hovered over the lump the way you hold your palm above a campfire to learn if the coals are still alive. Back in bed 12, the room welcomed us like a dog that has been pretending not to wait at the door. The monitors caught his rhythm again without complaint. The ER soundtrack crept back to normal. A distant cough, a call light, the squeak of a stretcher wheel that someone probably swore they'd oil last week. I pulled up the images on our terminal and scrolled through them with the satisfaction of a man proving to himself the world is tame. "Look," I said, angling the screen so Evan could see. "That's bone. That's skin. That oval is your lump. No invasion. No infection in the mastoid. No fluid where it shouldn't be. This is something we can cut out and send you home from." Evan's shoulders loosened, but not entirely. "And the other part?" he asked. "The part that's closer now?" I offered him the truth I had ready. Sometimes when we're on alert, the body amplifies sensation. Once we know what we're feeling, it feels stronger, like hearing your own heartbeat after you notice it. I believed myself just enough to say it. Janelle came in with water and the half-smile nurses wear when they're escorting fear out without making a scene. "ENT's on their way," she said. "They want to take a look at the images and then you. Might talk about taking it out this week." "Good," Evan said. He sipped the water. His hand drifted to the lump again. The air in bed 12 thickened in that hard-to-describe way rooms do when too much attention has been paid to 1 square foot of space. The fluorescent light hummed and then, almost kindly, quieted. If you've ever been in a room long enough with one persistent noise and it stops, you know how loud quiet is. The pulse ox on Evan's finger blinked from 98 to 89, and then back up before Janelle even had time to touch it. She checked the probe anyway, habit dictating a ritual. Wipe, rotate, reseat. The heart monitor chimed a heartbreakingly brief irregularity, then changed its mind. Faulty lead? I asked. Maybe, she said, though her eyes were on Evan, not the screen. He looked at me with the intensity of a man trying not to startle a wild animal. If you try to let it out, he said, don't stand in front. There's a kind of fear that makes you chuckle to break it. There's another kind that makes laughter feel like whistling past a graveyard. I didn't laugh. We're not letting anything out, I said. We're going to look, and if we need to drain it to ease the pressure, we'll do that safely. Pressure, he repeated, tasting the word like it belonged to someone else. ENT arrived not long after. Dr. Patel, young but already wearing the stillness that specialty requires. He greeted Evan, glanced at the images, and examined the lump with the cool, respectful pressure of a man who doesn't argue with skin. Likely an epidermoid cyst, he said. Benign. We can schedule excision within a day or two. If it's giving you a lot of discomfort now, we could do a small aspiration to decompress, but typically we prefer to remove it whole to avoid recurrence. What would you do? Evan asked. Dr. Patel weighed him with his eyes, then looked at me, a small handoff of responsibility that covered more ground than the words did. If he's tolerating, Dr. Patel said, I'd plan for excision soon. If discomfort escalates, aspiration's reasonable. Soon, Evan said, but there was calculation in it. He was listening to something I couldn't hear. Dr. Patel left to book an OR slot. Janelle adjusted the bed as if comfort were a lever she could set just right. I stood at the foot, hands in pockets, the way doctors stand when they're trying to look both busy and calm. Evan closed his eyes. The room exhaled. Seconds passed, tall and thin. Then he flinched, a small involuntary jerk of the head, and his hand flew to the lump as if something had knocked from the inside. Okay, he whispered. Okay. His eyes opened and found mine. It's at the door. The monitors behaved themselves. The air conditioner whispered its same indifferent breath. A sensible man would have ordered more waiting. I am not always sensible at 2 a.m. when a room leans. We can do a small aspiration, I said, patient to patient rather than doctor to patient. Relieve the pressure. It won't take long. Evan nodded, relief and dread arriving together. Janelle prepared the tray the way she always does. Field, syringe, lidocaine, needle, gauze, a small steel bowl that looks ceremonial no matter how many times you clean it. I scrubbed, gloved, and drew up the local. The needle slid under the skin to raise a pale wheal. Evan hissed once, then stilled. I palpated the superior edge of the mass, chose the safest angle that wouldn't threaten the small vein coursing behind the ear. The ER outside our curtain carried on with its rituals, a muffled liturgy we'd both grown up in. I settled the needle against the capsule, felt that tiny give you feel when you find the right plane, and paused with the plunger poised. Ready? I asked. Evan didn't look at me. He angled his gaze toward the corner of the room, like a man making eye contact with someone who had just walked in. Don't let it leave, he said. I nodded even though I didn't understand. My thumb tightened on the plunger. The room pulled itself taut, a bowstring waiting to sing, and I advanced the needle. The instant the needle entered, the world in bed 12 changed. There was no rush of fluid, no back pressure like you'd expect with a cyst. The syringe stayed stubbornly empty. But the plunger quivered under my thumb. Not because of my hand, not because of Evan's pulse. It trembled as if something on the other end had laid its breath against the plastic. The barrel fogged. A thin, ghostly condensation swirled inside. Impossible. like glass kissed by a mouth that wasn't there. Janelle made a sharp sound in her throat. I kept my hand steady, because that's what you're trained to do, even when training stops making sense. Evan's eyes snapped open. They weren't wide with pain, or fear, or even surprise. They were focused, fixed, as though he'd been waiting for this exact second. He whispered, "Don't let it out." The hum returned. Low at first, like the flutter of a distant engine, then closer, pressing into my right ear, drumming against the bones of my skull. The monitors joined in like a choir gone mad. Heart rate skipped into a rhythm that didn't belong to any human heart. The pulse ox dropped to 84, spiked to 100, then froze at 96 as though it had settled on a compromise. The telemetry lead gave a reading so jagged, I almost called a code, but Janelle's hand touched my arm, firm, steady, silencing the panic before it reached my mouth. "Doctor," she whispered, "stop." But I didn't. I advanced the needle just a fraction deeper. There was a click. Not cartilage, not bone. Not anything I'd ever felt beneath human skin. It was the sound of something unlocking. The hum split into two tones, a dissonant harmony that rattled through the room. The syringe in my hand grew colder. I felt the chill through the gloves, creeping up my wrist, a river running upstream. Evan gasped. His back arched slightly off the bed. And then the air itself seemed to move. Not a breeze, not the whir of vents. It was pressure, the way a storm front presses on your chest before lightning cracks the sky. I pulled the needle back, slowly, deliberately. The syringe fog thinned, but for a heartbeat it lingered, twisting like smoke caught in a jar. When I withdrew completely, the room snapped back. The monitors settled, the hum retreated. The syringe sat in my hand, empty, but colder than it had any right to be. Evan collapsed against the bed, chest heaving. "It's still here," he rasped. "What is?" I asked before I could stop myself. He shook his head, weak but certain. "It didn't leave. It's waiting." Janelle swore under her breath. She stepped forward, gathered the syringe, dropped it into the steel bowl with a metallic clatter too loud for the quiet. "Sterile," she said, voice clipped, like the word could erase what we'd seen. But her eyes betrayed her. She had seen it too. The curtain to bed 12 stirred then, though no one had walked past. The air pressure in the room shifted just enough to lift the fabric and let it fall again. Evan turned his head slightly, toward that thin, swaying strip of cloth, and he whispered, "It knows you now." I had no words. For the first time in my residency, I had nothing to anchor myself to, no lab value, no scan, no textbook explanation. Only the echo of that impossible fog inside an empty syringe. Only the way my name felt unspoken in the silence of the room. Only the terrible certainty that this wasn't over. That night, when ENT came back with their calm explanations and promises of surgery, I nodded in all the right places. I signed the chart. I gave the patient instructions like nothing unusual had happened. But every time I looked at Evan, I felt his eyes pulling me back to that moment when the needle clicked, when the air in the room wasn't just air anymore. And I couldn't shake the thought, what if I hadn't pulled back? What if I'd kept pushing? What would have come through? Observation. That's what we called it, when we weren't ready to send someone home, but didn't have enough reason to admit them upstairs. For Evan, it was a polite way of saying, "We don't know what's happening, so we're keeping you here, until daylight makes sense of it." We moved him to a corner room with a window that looked out onto the ambulance bay. The blinds were half drawn, the light outside casting a cold glow that never changed, whether it was 3 a.m. or 6 a.m. Janelle settled him in. She checked the IV line, replaced the monitor leads, fussed with the blanket longer than she needed to. It was busy work. It was nerves. Evan lay still, his hands folded again, but his eyes kept shifting toward the window, as though he could hear someone knocking just out of sight. I stayed longer than I should have. Residents aren't supposed to babysit patients through the night, but something about leaving him alone felt wrong, like walking away from a lit fuse. He turned to me once and said, "Do you ever feel like you're not the one choosing what you hear?" I didn't answer. Not because I didn't have words, but because the words I had felt like lies. Around 3:30, the ER slowed to its strange lull. A lull that isn't peace, but anticipation. The halls quieted. The code carts rested. The usual noise faded until you could hear the hum of the vents, like they were whispering secrets to each other. That's when it started again. Not with Evan, but with the room itself. The monitors, all of them, drifted just slightly out of sync. Heart rate, pulse ox, blood pressure cuff. Each ticked at its own tempo, as though 3 different drummers had decided to play in the same band. Janelle noticed first. She frowned, tapped the pulse ox probe, adjusted the cuff. The numbers corrected for a breath, then slipped again. "I don't like this," she muttered. "Neither did I." Evan exhaled slowly, like he'd been waiting for it. "See? It's leaning again." He pressed his palm lightly against the lump. "Closer." I told myself it was nothing more than equipment error, old batteries, interference. But the truth sat heavier than that. Because I could feel it too. The same pressure I'd felt in bed 12 was back, faint but growing, as if the walls themselves were breathing in and out. Evan closed his eyes and whispered, "Don't let it walk." A chill ran through me. At that moment, Dr. Patel returned. ENT specialists have a way of carrying calm into chaos, and he was no different. He smiled gently, checked Evan over, glanced at the scans again on the portable screen. "It's straightforward," he said. "Epidermoid cyst, nothing malignant. We'll excise tomorrow. Simple case." Simple. I almost envied him for being able to say the word. Evan looked past him, toward me. "If you cut it, cut wide." Dr. Patel chuckled lightly. "We'll take enough to get it all, I promise." But Evan wasn't smiling. His eyes locked on mine. "You heard it," he said softly, as though testing whether I'd admit it. I didn't answer, because the hum was in my bones again. Dr. Patel finished his exam, reassured Evan, and left to make arrangements. He never once looked unsettled. Janelle, though, she wouldn't meet my eyes. She busied herself with charting, her pen moving too fast, too hard against the paper. I knew she was writing the bare minimum, the same way I had earlier. You don't document ghosts, you document vitals. The hours dragged. At one point, Evan stirred and half sat up, his eyes glassy but alert. "It's at the door," he whispered. I didn't ask which door. The curtain rippled again, though no one had entered. I wanted to believe it was air currents, or the draft from the vent. But the movement was deliberate, too slow, too steady. Janelle whispered, "Doctor." Her voice broke the moment, and the curtain fell still. Evan lay back down, breathing evenly again. But his hand never left the lump. By dawn, the hospital woke in its usual way. The halls filled with carts rattling, staff changing shifts, the smell of fresh coffee cutting through the metallic tang of the night. Daylight has a way of lying to you, making the night seem like a bad dream. That morning, I almost let myself believe it. Almost. Because when I went back to check on Evan before rounds, he was awake, sitting up in bed, eyes clearer than they'd been all night. He smiled faintly and said, "It stopped knocking." Relief should have followed. It didn't. Because the way he said it sounded less like an ending and more like a truce. And as I left the room, I realized the hum hadn't faded completely. It lingered, low and patient, like something waiting for its turn. The next afternoon, Evan was prepped for surgery. It was supposed to be simple. A clean excision, 15 minutes from first incision to final stitch. ENT cases like this were routine, the kind of thing you could list off on rounds and forget by the end of the week. But I couldn't forget. Not after what I'd seen in bed 12. Not after that fog in the syringe. Not after the hum that had pressed into the marrow of the night. Still, we did what doctors do. We followed the ritual. Scrubs, masks, gloves. The overhead light blazed white. Dr. Patel led, calm as ever, with me standing to assist. Janelle was in the room too, handling instruments. I noticed her eyes were sharper than usual, tracking every motion as if expecting something to happen. The incision was neat, elliptical, just behind the ear. The scalpel slid through skin, then down into subcutaneous tissue. A small capsule revealed itself, pearly white, glistening under the light. It looked harmless. Too harmless. Dr. Patel murmured, "Classic epidermoid. We'll peel it out whole." He began to dissect around the capsule, separating it carefully from surrounding tissue. The room was quiet, except for the steady beep of the monitor. Then, as the capsule lifted free, I felt it. That same pressure. The hum. Not loud, not violent, but there, unmistakably, curling through the room like smoke no one else could see. I froze, holding the retractor in my hand. Janelle's eyes flicked up at me. She'd felt it too. Patel didn't notice. His hands were steady, precise. He placed the cyst in a specimen cup, sealed it, labeled it for pathology. To him, it was finished. To me, it wasn't. Because the moment the cyst left Evan's body, his shoulders eased like a weight had rolled off him. He opened his eyes slowly as the anesthesia wore down and whispered, almost too soft to hear, "It's gone." But the way he said it, it didn't sound like victory. It sounded like surrender. Recovery was smooth. Evan was awake within the hour, alert, grateful. He thanked us, smiled faintly, even laughed once when Janelle joked about the scar. By the next morning, he was discharged with instructions to rest and follow up in clinic. Pathology came back the next day. As expected, epidermoid cyst with laminated keratin, no atypia. Textbook. Ordinary, forgettable. Everyone forgot it but me. I went back to bed 12 that night, long after the case was over, long after the room had been turned over for another patient. The lights hummed, the curtains swayed. I stood there longer than I should have, listening, and I swear I still heard it. That low flutter, that double tone. Not loud, not insistent, just waiting. Since then, years have passed. I finished residency, became a surgeon, built a career around order and control. But every time I walk past a patient bed at night, every time I place my hand on a swelling under the skin, I remember Evan. I remember the fog in the syringe. I remember the way he said, "Don't let it leave." I remember the hum that no one wants to admit they heard. And I remember the look in his eyes when he whispered, "It's gone." Because even then I didn't believe it was. The case will always remind me that medicine can cut out what the body grows, but it cannot seal every door we accidentally open. Some doors stay cracked. Some doors wait. And sometimes, late at night, when the ER hums and the walls breathe like lungs, I wonder, did we remove a cyst? Or did we interrupt something trying to escape? What do you believe? Was it nothing more than biology, an ordinary lump that played tricks on our senses? Or was it something darker, something waiting for a body to use as a door? Because I still don't know, and I don't think I ever will.